What's up, everyone? This is Dr. Charlie Johnson, physical therapist. And in this video today, I want to share with you a sort of different way and or potentially better way of thinking about how you're doing exercises to resolve your back, butt, and or sciatica problem. Specifically, we'll be talking about different types of strengthening or strength-based exercises that you've probably seen online to work your back and glutes and things like that. And I want to share with you a simple tweak or shift, again, in the way that you're doing it that can potentially improve results. And I think that this is meaningful because this is something that most people are not aware of, haven't been taught and or heard of and or thought about. So I want to share that with you today in this video. Those of you who do not know me, my name is Dr. Charlie Johnson. I'm a physical therapist. And essentially what I do is I help teach people all around the world with back, butt, and sciatica problems how to resolve their own pain by giving them tools, knowledge, understanding, support, and resources to solve the problem naturally. That being said, just to recognize that the purpose of today's video is not to help you figure out what's going on with your back, butt, and or leg pain that you're experiencing. So instead, what I would recommend is you check out my DIY diagnostic guide. It's probably overhead like this airplane flying overhead, and feel free to check it out and download it there. All right, so let's dive into it. So let's talk about strengthening your back and butt because as you'll see, there's lots of stuff that recommends doing this for your back and or piriformis type problems. And so let's chat about it. All right, so realize that this sort of video is based off of this quote, if you will, right? So sometimes it's not what you do, it's how you do it. I don't know who said that, but I would say in this case, it's pretty true, right? So sometimes you probably heard maybe from your mom, your dad, parents, whatever, some mentor or other influential figure in your life that sometimes it's not what you say, it's how you say it, right? So we're going to talk about a different way that you can do exercise and things like that to get a different result. So look, the number one question I get from people who have these issues, right, is what exercises should I be doing? And the truth is that there are just so many different things that you could do. So we're not going to chat about that. And it's just based off of how bad you hurt, when you hurt, what happened, how long you've had your pain, right, etc. That we're not going to chat about that directly. But we'll chat about the second most common question. And it's, how do I do it? So Charlie, I'm doing these different exercises, but how do I do it, right? How do I strengthen my back or my butt or my legs or whatever? And what are some different ways that I can think about doing that? So this involves conversation around multiple elements, if you will. So form, how much do you do it? How often do you do it? So how much would be like the dose, I would call it. How often would be the frequency? When would be like the timing of when you do it, right? So if movement were a pill, right, you'd have different elements surrounding the dose, the frequency, and the timing of exercise. So specifically, we're going to talk about just one or two of these elements. All right, so hang on in there. Right, and the answer to the first question of what exercise do I do really just depends. So the second question is more clear. How do I do it? We're going to chat about that. And again, there's no shortage of ways to reduce your pain, including many different exercises. So if you just do a quick piriformis exercise or sciatica exercises, right, you'll see all kinds of different stuff. Most of them will be very similar, but they'll be all over the place. And you can see there's just a bunch of different stuff here. This was just pulled off of Google. Hopefully I'm allowed to use this. And then if you look at Bob and Brad, right, or McGill or McKenzie, right, you'll see there's different sort of theories and or world views about how you should approach this. So there you go. There's a core exercise for back pain. What do you know? This guy's just pointing the other way. And what do you know? This person's going the same way. And this is the same thing. All right. So you'll recognize that many of them are very similar, but just sort of reiterated by different folks all around the world. And again, I'm not saying, look, that you should do these things or you shouldn't do these things. So that's kind of beyond the conversation of this. If they help, great. If they don't, cool. Probably need to find out some process and system for figuring out what you need to do versus randomly trying a bunch of different stuff, because that doesn't work very well, just leads to chaos and confusion. So again, that's beyond the scope of this video, but just recognize that you've probably seen some of these things and maybe even tried some of them. So I want to shift your paradigm around how you're approaching it potentially. All right. So let's talk specifically about these strength-based exercises, as you saw the bird dog, right, or this or that, and how you might tweak how you're doing them to get a better result and kind of switch the approach, right? So same exercise, but different approach, different way of doing it to potentially, again, change the impact it has on your body. So let me explain. So when it comes to how you actually perform a specific exercise, right, there are several things to consider. So we talked about, hey, dose, like how much do I do it, and the timing of it, and the frequency, right? We're really going to talk about sort of dosage and the specifics of reps which is probably what you're used to, versus holds, something maybe haven't thought of, and or sort of the tempo of how you do these things, right? So you can either choose to do reps, or you can choose to hold different positions with your body. You can choose to do things fast or slow or somewhere in the middle. So there's some spectrum there, right? So get that the default for most people is to perform reps, right? And if you've gotten a sheet of exercise and you've gone home with it and you have some type of back or butt or sciatica problem, they probably told you, hey, do, maybe 3 sets of 10 of this. So opposite arm, opposite leg, you're doing bird dog, or maybe this plank, maybe you do some holds with a plank. But at the end of the day, right, most people do reps for most exercises. And basically reps can be defined in my world as just repeatedly doing a motion or an exercise over and over again, right, until a certain point, right? Whether that's 10 reps, because that's when they told you to stop, and you just do it because that's what they said, and or you do it until you're tired or whatever. And it's usually at a rather decent clip, right? So most people aren't doing reps like this. You go to the gym, right? You watch somebody do bicep curls, or they 1, 2. No, they're not doing that, right? They're kind of cranking them out 1, 2, and that's just the way most people do it, right? So for example, again, I'm not saying do these or don't do these, but these are very common. So you see that little hyperextension machine, right? You've probably seen that in the gym. Maybe if you have back pain, you've tried that, right? So you go down, you go up, you go down, you go up. Maybe do 3 sets of 10 of that. Or you do opposite arm, opposite leg, 3 sets of 10 on each leg, or 3 sets of 10 or 15 bridges or leg raises, whatever it is. But why? Why do you do that? Do you do it because somebody just told you to do it, right? And you trust that person because you think you should be able to, because they're the doctor and they know everything, right? You really want to start to be accountable for your own rehab, because if I tell you what to do, I mean, yes, that's useful and you need a little bit of training wheels in the beginning, but if I tell you what to do, then you don't know what to do on your own. So you need to start asking questions, right? So the quality of your rehab will be determined by the quality of your questions. So you need to be asking hey, why am I doing this? And don't be afraid to challenge folks on that. All right. It's okay if they don't have a perfect answer. I don't have a perfect answer to everything all the time either, but consider asking questions and really understanding why am I doing this? And when should I do this? And how should I do this? And hopefully they have some logic behind it, right? So, so why reps, and why 3 sets of 10 reps, for example, which is very common. And it's a really good question. It's something I would ask of the person that you're working with. But I want to kind of help you understand maybe the logic here, because that's really theoretical. So something to consider, right, is this concept of what type of muscle are we dealing with, or what type of muscle are we trying to rehab and why, right? So there's this concept that you should understand of slow versus fast twitch muscle fibers, right? So basically, science has shown that that most deep muscles in the back and glute, right, are primarily type 1 slow twitch muscle fibers, right? And you can look this up if you need more info, but basically high level, meaning that they are designed for endurance. All right. And of course, there's always some mix, right, of slow and fast twitch muscle fibers within any given muscle. But the majority of these muscles appear to have a greater ratio of slow to fast twitch fibers. And so who cares and why does it matter? Well, let me explain. So if this is true, and the majority of these muscles that we're trying to rehab or strengthen or do whatever we're trying to do, right, in the painful area, if that's the approach you want to take, not always, you don't have to do that for sure. But if that is the approach that you've been trying to take, then these muscles will respond better to greater time under tension. And I'll explain to you what I mean by this. But essentially, what I mean is that prolonged low load holds, so that's sustaining the effort or the contraction or the time under tension, for lack of better terms, or to relate it back to that, is really what's needed, not 3 sets of 10 reps. All right. So you need to challenge these areas. So this also goes to another concept called specificity of training. So ideally, you train the muscle in a way that is consistent with how it functions or how it's designed in this case, right? So the muscles that are designed primarily for endurance, slow type 1 twitch muscle fibers, should be challenged with endurance training. Right. So in my experience, rehab exercises don't have to be complicated. If you look on Instagram, if you look other places on YouTube, you'll see that lots of times these exercises are really overcomplicated. You're standing on one leg while you're pulling on a rope, and then someone's throwing a ball at you. And, that's just a good way to get hurt, if you ask me. So they don't have to be complicated, but they do have to be challenging. All right. So again, this goes back to the initial kind of, supporting quote, if you will, or driving quote behind this kind of chat, right? So it's not what you do, it's how you do it. So many rehab programs are simply not challenging enough and don't place the muscles under enough tension for long enough, time under tension, to create a meaningful change. So let's make this real for you. So here are 4 reasons why science, in my experience, shows that holds, or placing the muscle tissue in this area specifically, if you have one of these issues, for a longer amount of time works better than reps for pain relief. You can use reps, but I'll share with you how I might want to think of it different. So number one, it's been observed that deep lower back muscles are smaller and have more what we call fatty infiltration in folks with back issues. So you can, what we found, all right, is that if you have back pain, even after you rehab and the back pain goes away, you still show some type of difference there in the muscle, meaning the muscle just doesn't bounce back and sort of come back to full strength. It's atrophied, it's smaller, it's not as strong as maybe it once was. The other thing you can see here in these pictures, right, that folks who have back pain, in this case specifically, this is a picture of the spine. So if this was a spine, you lop it off here and you're looking down on it, right? You can see that the tissue, we say fat grade 0, fat grade 1, fat grade 2, right? The quality is different. So let's just say that the person, not sure if this is the case or not, but a person on the left has no back pain, right? This would be more characteristic actually of somebody who has not a history of back pain. So their muscles are kind of nice and dense and you don't see all that white stuff kind of going through it. You know, if you like steak, if you don't, sorry, maybe this will ruin your steak eating experience, but consider this as the marbling, the fat within the tissue, all right? Makes sense for a steak, not if you have back pain, all right? But at the end of the day, picture all the way on the left there is somebody who's probably healthy and or doesn't have a high, doesn't have a history of back issues, right? So really dense tissue, right? And then, you know, you can see that it starts to get a little bit more white and broken up. And then you can see fat grade 2, if you will, right, is highly infiltrated, if you will, with fat. And obviously that muscle on the right is probably not going to function as well. I think that makes logical sense as the muscle on the left. It's going to be weaker. It's going to be less functional, if you will. All right. So also folks with hip pain, right, show thinning of the muscles on the outside of the hips or the glutes or things like that, right, as well as micro tears and or trauma. And this is maybe suggestive of weakness, right? So therefore it might, and again, this exists a little bit in theory, you'd have to figure this out for yourself and or work with somebody that you trust to help you solve this, but it might make sense to change all of this if we could, right? And we have some evidence that we can change a bit of this via strengthening. So prolonged low load holds, multiple sets of 45 to 60 second holds, ideally until tired, allow the muscle to experience enough time under tension and basically receive the stimulus required for change. So for example, let's just say that you're trying to strengthen your glutes, right, which are predominantly slow twitch endurance fibers, right? And you decide to do some bridges because you heard from everybody that's what you should do, right? They're good for back problems, butt problems, etc. So and you're told to do this exercise up and down 3 sets of 10 reps. This would be a common exercise, right? So let's just say that assuming each rep takes 2 seconds, so like second up, second down, right? And you're just going at like, I don't know, a slow but steady pace, nothing super quick, but a couple seconds for each rep, times 10 reps, then this would equal 20 seconds total time under tension. And this is nowhere near the recommended 45 to 60 seconds of time under tension to actually build strength or to sufficiently challenge this muscle to actually want to change or do anything or look differently. All right. So that's that. So instead, why not hold this position for 3 sets until tired, 40 to 60 seconds total, right? Or slow the tempo. Remember we talked about fast versus slow and that tempo kind of spectrum, such that each rep takes 6 seconds times 10 reps for a total of 60 seconds. So right, if you're in PT right now, you're doing 3 sets of 10 reps. Each one is up and down, right? 2 seconds times 10 reps, right? That's 20 total seconds time under tension. Probably not sufficient enough to cause a change. Well, you could take your current PT exercise and say, hey, I can apply this concept by just slowing the tempo if I want to still do reps and not get in trouble by not doing what they told me to do, right? So if you want to be, what do you call that? Somebody who is, what do you call somebody who is follows the rules?
Rule follower?
Not a rule follower. Oh. They're not complacent.
Oh.
They're shit, I can't figure it out. Anyway, if you want to be a rule follower, all right, then what you would do is you could just slow down the tempo and notice that you can do the same amount of reps. I did exactly what you told me, but I just slowed it down and I got more time under tension. Not diligent. Studious. If you want to be studious, that's not the word either. Anyway, hopefully you get the idea. All right. So you're creating greater time under tension, right? So let's just say you do an exercise like this. This is another common rehab exercise. Again, not sure if you should do it or not, but let's just say you're using this orange band and you're standing in front of an orange wall and you're using the complementary color of orange, which is sort of that bluish purplish. It's purple. So it's not exactly blue. Maybe it's blue. I don't know. Okay. Orange band, 3 times 10 reps, and you're tired, right? Great. So each rep equals 2 seconds. Let's just say out and in times 10 reps, 20 seconds again, total time under tension, right? Or how about this? So what you could do is you could reduce the resistance and perform holds or more reps or slower reps to increase the time under tension, because 20 seconds is really not enough time under tension to really do anything if you're looking for strength gains, if that's the objective. All right. So the second kind of thing you might want to consider, right, when it comes to how to perform exercise and why I recommend maybe holds or at least increasing that time under tension versus just banging out some reps, is that isometric holds appear to reduce pain and or improve function better than reps. So there's just a couple articles and there's lots of other stuff, but isotonic, which is like you doing this in the gym, 1, 2, 3 repetitions, the joint is moving, versus just holding it. Imagine just holding a bicep curl, hold, right? Isotonic versus isometric exercise on core muscles in patients with low back pain. It seems like isometrics work a bit better there as far as improving function of those folks who do that. The effectiveness of isometric contractions compared to isotonic contractions and reducing pain for these people with like tendon problems in their knee. So it's not just related to the back. And here's the thing, I don't really have anything related to, the butt and or, sciatic type issues, because, well, sciatic nerve is a nerve and therefore it can't contract. But at the end of the day, right, we could probably say that there's some maybe application of this. So just recognize that you might find some things that are against this, but the idea is that for whatever reason, isometrics seem to be better at reducing the pain experience. All right. So another reason why you might want to consider holds versus repetitions. The third thing, right, to consider is that holds reduce the chance of form breakdown. Now, this is something based off my experience. I don't have any evidence to support this, but basically there's a whole busload of kids here and they're going to interrupt this in a moment. So I will probably be back in a moment, but holds reduce the chance of form breakdown. 1 rep held for time versus many reps equals less room for error. And if you just think about it, it makes sense. So like, if you're like, oh, I don't really know how to do this, I've never done this, and you go and you're doing all this stuff, right? Then every rep is a chance for you to screw something up. Versus if you just get in there and you hold resistance against a ceiling, like trying to push it up, right? Then once you figure out the position, you're kind of there and you can't really mess it up, right? And finally, the fourth thing, kind of going along with this, is that there's less moving parts. Literally, an isometric is the absence of a joint moving, right? But you still have resistance, all right? So there's less moving parts, which is often perceived to be safer and less threatening, especially if you have motion restrictions. If when you move your back a certain way, imagine being on that machine, right? You're doing these back extensions. Ow, ow, ow. Why do that when you can just hold it in a certain position, get there and feel confident doing so? All right, so something to think about. So look, next time you wonder, hey, what exercise should I be doing? That's part of the answer for sure. But you might want to also consider asking, how should I be doing that? Right? And really thinking deeply around what that looks like. Just recognize that there's an art to figuring that out. And you could be very close to solving the problem, right? But if you're not sure exactly how you should be doing it, as far as dosage, how much, frequency, right? How often, and then timing. And within dosage, reps versus holds, or this many versus that many, then you could be missing the boat. So there's more to it than just like, hey, what exercise do I do for this problem? And like, how much, right? There's more to it. So just recognize that a lot of people get mad at me because they're like, hey, you're withholding information. No, I'm not withholding information. I'm withholding information from you, if you want to think of it like that, because I don't want you to screw yourself up. And there's too many things. And if I wanted to be like other folks on YouTube and just say like, hey, if you have this thing, do this exercise, then recognize that it would help many people, but it would also make many people worse. And I don't want you to be one of them. All right. So just sharing that candidly. All right. That's all for now. Hopefully that was useful. And hopefully you enjoyed the sounds of planes and trains and kiddos in the background. If you want to sort of better understand the process, right, the specifics of like, how does Charlie think about, what to do, and how does Charlie sort of coach people through this this healing journey, right? I sort of share my process and my more of my reasoning and my logic, right, inside of my free Beat Butt Pain workshop. So what you can do is you can check that out above. I can link that here and or below. You can register for that. It's completely free, right? And I let you inside my brain to kind of share with you the process that I help folks all around the world use to solve their pain in the butt. So that's all I got. Until next time, chat soon.